Hello, Dr. Cole. My name is Jonathan. I'm actually with the pharmacy department, and we just saw a patient, SD. So SD is a 58-year-old white male who presented to the infectious disease clinic for chronic HCV infection. He was recently hospitalized and successfully treated for CAP and was also diagnosed with genotype 1A HCV. All right, so SD, he has a past medical history of type 2 diabetes mellitus and controlled hypertension. So patient consumes 2 to 6 beers on the weekends, he says, and he's a prior IV drug user and used marijuana as well. He said he hasn't used it since 1992. And his labs from the day of discharge show that his ALTs and ASTs were elevated at 64 and 120 respectively. His HCV RNA was at 5,300,000 international units per milliliter. So we also noticed that his diabetes was uncontrolled. His A1C was 9.7%, and his glucose was 215 milligrams per deciliter. He had a BMI of 39, so he's obese, and he's currently only on metformin 1,000 milligrams by mouth twice daily for his diabetes. All right, so SD will need to be treated for his chronic HCV infection. Pharmacy was consulted for treatment for this. And based on his lab values, the patient does not have cirrhosis. The goal is to reduce mortality, improve liver function, and achieve sustained virological cure by having an undetectable HCV RNA viral load. As far as his diabetes, the goal per ADA guidelines is to have his A1C below 7.7% and a fasting glucose between 80 and 130 milligrams per deciliter, and then postprandial glucose level under 180. Right now, patient is above goal. As we said, it's 9.7%, and we would like to initiate insulin therapy to try to reach this goal. To note, patient has also had his vaccines for hepatitis A and hepatitis B. All right. After speaking with SD's wife, we decided to initiate Harvoni, which is 90 milligrams of ledipasvir and 400 milligrams of sofosbuvir. 1 tablet by mouth once a day for 8 weeks. On the 4th week of therapy, we want to monitor the HCV RNA viral load. We want to monitor their CBC, renal, and hepatic function. We want to repeat the LFTs every 2 weeks until it returns to baseline. After the 8th week of therapy, we want to repeat the test of the HCV RNA viral load to make sure that it's negative. And we made the patient aware during the counseling session of how to avoid transmitting the disease to others. And then for diabetes, we want to initiate Lantus 10 units subcutaneously every night. We do suggest that the patient monitors their blood glucose, their fasting in the morning, and then postprandial. And we want them to check their A1C every 3 months until it's controlled, and then every 6 months after that. We did suggest that the patient quits drinking alcohol while taking these medications, controlling their body weight, and increasing their activity, so their exercise level, to help improve their A1C. We also recommend that the patient gets their Prevnar 13 vaccine, pneumococcal 23, and their annual flu shots, obviously to prevent pneumonia and the flu.